So how do you build self-awareness in a condition that seems to feel like it has a mind of its own and might be out of our hands because it's related to a neurochemical imbalance or a genetic connection or even severe trauma in the past? Self-awareness is difficult to do when you're in the acute stages of any mental health problem, especially if you're deeply depressed or very elated. However, one of the advantages of getting into a good space, whether it's through treatment or it's naturally come about because that's your pattern, is take advantage of those periods of time where your mood is balanced. That is the time to be self-aware. That is the time to reflect back and harness the power of hindsight. Now, one of the powerful things about bipolar affective disorder is that insight is actually relatively well preserved. Many people with bipolar affective disorder remember what they were like when they were depressed. They remember what they were like when they were manic. And it can be really powerful to keep a record, a mood diary of how you're feeling, when you were feeling it, what was going on in your life at that time, what helped you, what didn't help you, what's been your relationship with taking your medication, have you been regular with it, have you been missing it? Remember, with the medication for bipolar affective disorder, it has a role to play in keeping you well as treating each episode. So it's really important that you stay consistent. If you have relatives or loved ones who are struggling with bipolar affective disorder, then if you can support them to maintain their insight and the importance of staying on top of their treatment, as well as recognizing what their triggers might be and how to access help quickly, these are some of the best things you can do for them and for yourself so that you're not left having to manage crises on a regular basis. And remember, the quicker you get any mental health disorder seen to, the less likely it is to spiral into a more severe and enduring mental health problem, the more quickly it will respond to treatment, and the more likely you are to maintain your sense of self-esteem and self-confidence and feel empowered to understand that you are not your mental illness. Mental illness is something you experience, but it doesn't define you. I'd love for you to join this community and shape the content we produce. Please subscribe by clicking the link below.